The key to staying successful yet sane while starting your medical billing business and working full time is to choose the right services that you will offer to your clients. When you choose the right services, you'll be able to grow your business without burnout. So keep watching. So today is day 8 of our series from medical biller to billing business owner, balancing work and entrepreneurship. So I hope you have caught the other 7 videos. If you haven't done that after you watch this video, make sure you watch those and make sure you put on your notification bell and hit that subscribe button so that you won't miss the other 12 videos that I'm going to be dropping throughout November. I'm going to be discussing the critical decision that can make or break your medical billing business journey, and that is choosing the right services for you and for your unique situation. Remember, everybody is not the same. Everybody's medical billing business looks differently, so you need to decide what is best for you. Which services align with your time, your skills, and your client needs are some of the things that you need to think about when you are choosing what services you want to offer. So there are many services that you can offer. You can offer denial management, pre-authorizations, coding, credentialing, consulting. I can go on and on and on. You can offer so many different services. But remember, you do not have to offer every living service that there is. You can decide on certain services, especially to the beginning. And in fact, I recommend that you only offer a limited amount of services, especially at the beginning. Now, here are a few questions that I think you should ask yourself so that you can figure out what services you want to offer. The first question is, what have you mastered and what skills do you have? Now, you don't have to be perfect in the skills that you have. Again, nobody's perfect, and you might want to learn more about this specific area. But what skills do you have that you think you can capitalize on? Make sure that these skills are ones that you feel comfortable doing. Remember, you are the one who's doing these services, or you have to hire someone who does these services. And even though you hire, you need to know how to do them. So what services do you feel comfortable offering? Even if you have to learn a little bit more about them, you don't mind putting in a little bit of work and learning more about it. Then you might think about if you have a specialty that you are really good at. Now, you might have been one of those billers who have done a lot of different specialties, and maybe you don't want to just do one, and that's totally fine. But sometimes you have done a specialty over and over again, and you feel like you have mastered that specialty. Not mastering it being perfect, but just mastering it and knowing it enough how to maneuver when, you have to deal with the claims and denials and all of those things. You feel comfortable in dealing with that. And let me give you a little story for myself. So I am an end-to-end biller. Every job that I have had as a biller, I've done from claim submission to patient statements. So when it was time to do my medical billing business services, or figure out what my medical billing business services would be, I decided that I wanted to do end-to-end billing. I wanted to do from claim submission to patient statements. But as I started to go into it more and more, I decided, do I really want to do patient statements? Now, I do patient statements for some of my clients, and I don't do it for other clients. Again, that's because I can do that. I can make that decision. So because each client is different, I may decide that patient statements is not for me. Especially with me working a full-time job, patients cannot just call me up, and I can't just answer the phone, and I just can't do those things. So I wouldn't want to do patient statements and the patients can't call me. Now, I do have a client that I am doing patient statements for, but we have that agreement that the patients will call the office. And if I need to call them, then they will let me know, but I won't be calling patients and answering phone calls from the patients all the time. There are some medical billing businesses where the patients don't call the office and they call the billing company. Again, this is unique to each billing company. So you have to think about those things and decide if this is what you want to do or if you don't want to do it. Then you should figure out how much time you have to work this medical billing business. And depending on the time that you have, that will influence the services that you offer. Because you're already working your full-time job while doing this medical billing business, you need to see where there are pockets of time that you will be able to do your billing business. But you also want to factor in your personal life. So you don't want to fill up all of the free time that you have outside of your full-time job and say, well, I'm going to use that time to do my business services. That's probably not going to work. You're going to need some time for yourself. So you also need to factor in your personal life. Then you can figure out what time you have left to do your billing for your clients. There are time-intensive services. So something like maybe claims management and rejections may take you, a quick time, especially if this is a small provider and they don't have that many claims. So you probably can do that service pretty quickly. You can handle 5, 6, 7 providers. But if you're doing coding for that provider, or if you're doing denial management for that provider, you might need a lot more time. And let me not say might, you're gonna need more time to deal with denial management. So you're gonna need to kind of weigh each service and how long it's going to take you. And then you need to factor in how much time you have to do those services. Then there are those streamlined services. So you have certain services that you don't necessarily need to do during the regular work hours. So you can send out claims after hours. You can send out claims whenever you want to send out claims. 1 o'clock in the morning, 9 o'clock at night, you can send out claims. So you want to streamline all of those services and say, well, I will probably do all of those together. But then there are other services that you will probably have to do during the middle of the day or times of the day where you may be at work or you may be occupied and you can't do it. So let me give you an example. For me, I do not offer pre-authorizations or eligibility and verification. The reason for that is because I will not be available for now. Again, I work a full-time job. And so when a patient comes in and needs a pre-authorization today, I can't do that. And I don't want the provider waiting on me, maybe can't see a patient or something goes wrong because they need the pre-authorizations now. Also, when it comes to eligibility and verification, that's also something. I cannot do that now. So I think that is a job that the front desk can handle, pre-authorizations and eligibility and verification. And when I'm talking to a provider, I let them know that that is not a service that I offer, but this person in your front desk can deal with it. Maybe they don't know that. Maybe their last biller did that. But I can let them know that it doesn't have to be done by me and it can still get done on time and when they need it to get done. And one question that is really important to ask yourself is, what services do your clients need? Now, again, I told you that you can pick and choose the services that you want to offer. But if you're offering services that your clients don't need, then you're probably not going to get any clients, right? So you need to keep in mind what they need, what they're looking for. Sometimes you might speak to a provider who is asking you to do their billing and they'll tell you what they need. I need somebody who's going to deal with denial management. I need somebody who's going to credential me for these payers. They will tell you the services that they're looking for. There will also be areas that maybe they don't even know that they need, or that they know that they need, but they don't want to do. For example, a lot of times when providers do their own billing, they do not do agent reports. They do not even do reports in general, right? So they don't even know that they need it, because reports are important to help you with deciding what you're going to do moving forward, what's not working, what is working. Reports help you with that. But sometimes they don't even know that they need to do that. So those are services that they don't know that you can offer and let them know that they do need to have in their business or in their practice. And then you have those services that maybe they know, they know they need to send out claims. They even know they need to do rejections and check up on them and follow up on them and denials and all of that stuff. But most of the times providers do not want to do that. So as far as those services are concerned, again, you can let them know that you can take that over from them and they can just worry about their patients and dealing with them and not worry about the back end of doing the billing. And don't feel bad if you have to start small and then gradually grow. Again, your client may want you to do a whole gamut of stuff. They may want you to do the billing, do the credentialing, consult, train, do everything. But you can start small, and you can tell them, maybe I'll start first by maybe training your staff to show them what to do as far as the front desk and collecting information. And then maybe you might grow into doing their billing for them, and then grow from there and doing the credentialing. And you can grow. You don't have to do all of these things at once, because you don't know if you can even handle them. You might not even like to do them, for your client. So you don't want to start them out in doing something for them and then decide you're not doing it, you don't want to do it. So start slow. Start off with a few services, or a couple services, meaning 2, or even 1, and then move on from that. After deciding on the services you want to offer, pricing is the next thing. And I know you guys want to hear about that, so make sure you catch me over in that next video.